Hello, everybody. This is Dr. Manjula Klavara speaking, and I'm sharing on menstrual health and hygiene today because it's an important social issue that the community has to grapple with. There's some important numbers that we need to be aware of, and those are as follows. 35 lakhs of women and girls menstruate in India every year, out of which 71% of girls did not even know about the onset of menstruation. When it happened, they experienced fear, anxiety, pain, and frustration. 40% of the government schools don't have toilets. And out of the ones that do, 40% don't have any separate facilities for girls, or they don't have running water. 70% of the women in India cannot buy pads. 12% of users produce 9,000 tons of pad waste, which is non-biodegradable because of the plastic lining. So what are menses? Menses are a blessing. It is given to the woman with the ability to reproduce future generations. It is a sign of physical maturity. It's a milestone. From that time on, from menarche onwards, the girl child continues to grow into a young woman. The body changes occur, mental changes occur, and she matures. It also protects from chronic diseases, especially like hypertension, diabetes, and other familial diseases. Premenstrual syndrome is a combination of symptoms that occur before the onset of the actual bleeding. It includes backache, tiredness, pain in the legs, cramps, headache, migraine, anxiety, fullness of breast due to water retention, etc., etc. The challenge of menses. The main challenge is ignorance and wrong tradition. Every woman has to face different challenges because her body is unique and she's different. Many places, there's no privacy. The house is small, there are too many family members, no toilets to go out to. And even if they are small, not lighted, not properly enclosed. And they have to go out into the fields or hide behind trees. And then there's always the presence of adulterous men and relatives and neighbors that makes life very difficult for especially young women. The traditional thinking is that women are unclean during the period and should live outside alone, often in the animal house. It's a terrible experience. Not treating menses related problems because it is a natural process is a very common tradition. It's not correct. It should be, people who are in need should be treated. There's no addiction and it does no harm. It helps, in fact, helps cope with pain. Water shortage is a real problem. Most of India doesn't have running water. Also, the woman suffers from anemia. She's weak and in difficult situations, and these make menses a big problem. The pad has to be changed 3 to 4 times a day just because of contact. Even if there's a small amount of blood in the pad, it acts as a medium for germs to multiply in the warm and humid conditions. It gives a bad odor and can cause infections. Most importantly, for hygiene related to menses is women have to wash from front back, never back forward. And this will avoid infections. Also, they should not use any soap or any other products inside themselves. It's not needed. Washing with water, clean water, is good enough. Pad rash is an unfortunate reality. Wearing the pad and walking or running or working, it causes chafing of the skin, redness, pain, sometimes pustules, blisters, and that makes walking very difficult. What can be done? Wash well, dry, pat dry, rest, apply some antibiotic cream, and use other pads. For women who suffer pad allergy are often allergic to the plastic or the latex from the pad. Homemade reusable pads are a good option. They have to be washed and kept properly. During menses, bathing daily, keeping the body clean is important. Pad disposal is an important issue. After use, reusable pads can be washed, dried, stored in a clean, dry place for further use. Especially that there should be no further damage, or the rats shouldn't bite it, or cockroaches should not get to it. It can be boxed or wrapped in a clean cloth. Whereas disposable pads have to be burned either one at a time or all together. Homemade pads that can be made with a clean cloth and a square cloth with cotton wrapped in it. And after use, the cloth can be washed and the cotton should be burnt. Menstrual pain is a sad fact. Some women suffer severe pain while others have no pain at all. In fact, they have no sensation that the menses are happening. Those who suffer pain should take painkillers to cope with cramps and pain. These drugs, medicines are not addictive and they help deal with menses. Heating baths also bring relief. A gentle massage is very kind and helpful. Please consult your doctor before taking any medicines. Be sure that you do not have any drug allergies. And before taking the drugs, please eat something. Rest, recover, restore. This is a process to recover from any sickness. Resting during menses is important to control the flow and the pain that accompanies the menses. Light exercises or work and rest is ideal. The fact is, the bleeding is only from 10 to a max of 80 ml. Young girls bleed about 10 to 12 ml. That means it's just a cup or less. If the person is bleeding even less than that, then she needs to get her blood tested to see if she has anemia or any other problem. A healthy diet during her life is important to strengthen her to cope with her day-to-day challenges. An egg a day is a great nutrition. If a lady has excessive bleeding and she needs to change her pads frequently, up to 6 pads a day, and then she should see a gynecologist, get her checkup done, get blood tests, investigation, sonogram, and diagnose her problem. Women with irregular periods should also see a gynecologist, but they need to take the treatment regularly. PCOD, PCOS is a very common problem with young girls and women, and it should be treated as soon as possible and regularly. It's a long-term problem. Health education is extremely important in our country. It's important to inform and prepare young children for menarche. 9-year-old onwards, girls should be informed about menstruation, how to deal with it, and what to do when it arrives. Especially within the family, the mother should demonstrate how she copes with her menses, or the sisters are there, and they should show how to deal with this issue so that when it finally arrives, there's no anxiety or fear. A pad should be placed in a packet and included in the school bag for use in emergency. They should be taught how to use it. And nowadays, many schools provide sanitary pads in case of emergency. We should be very loving and encouraging to prepare young girls for this remarkable event, because they will then bloom into beautiful young ladies. They are the future of our nation. The sad thing is sexual violence. Most false assumptions are that the rape occurs at night in unknown places by unknown people. It occurs to only beautiful and scantily dressed women of bad character. And during sex, when women and girls say no, it actually means yes. Nothing can be farther than the truth. The truth is, 10% of rape is by unknown people. But very sad to say that 90% of rape is by people known to the women and girls. They are people whom they live with, whom they trust and love. They are neighbors and relatives. Every country, color, language, age, even handicapped women and girls suffer from unwanted sexual violence. Every person has the legal right to say no and refuse sex. It's important to be responsible citizens in this nation and to stand against sexual, physical, verbal abuse and violence. It's important to educate their sons and boys and men at home by modeling good behavior and speech that is full of grace. God has called everyone, every male especially, to be the priest, provider, and protector in their family and in their workplace. They have to be taught how to do it. In every forum, at least there should be some capsule about health, about talking against rape and violence at home and among friends. And so it's important to inform society that it's not okay, it's not right to be violent or to rape. It's not a show of power. It's important to promote sexual norms that protect against violence, to teach skills to prevent sexual violence, to provide opportunities to empower and support women and children, girls, to create a protective environment, and to support victims and survivors to lessen harm. And in an African nation, during COVID, there was an increase of more than 5,000 unwanted teen pregnancies. That speaks a lot about victims being stuck with the perpetrators. And that was so sad. Also in another nation, in Africa, where rape is rampant, they began teaching in schools, both boys and girls, say no to rape, and how self-defense to girls and boys and how they can protect themselves or others from rape. And they are proud to say that the incidence of rape came down by 50%. And it's worth implementing something so critical and important in our nation to empower and strengthen our community. Menstruation is not just a woman's problem. It's a health issue and it's a social issue. The issue has to be grappled with by the community. Every woman belongs to a family. She could be your grandmother, mother, sister, wife, daughter, granddaughter, neighbor, friend. And men have to participate in their family by providing for their needs, to encourage and to love them. Everyone has to participate in order to make this issue a comfortable and happy and good issue for the nation, for the community, for the family, and for the woman. Together, we have to work together to make menstruation the blessing that God has created it to be. Thank you very much.